What's going on, HS Warriors? My name is Dominic Giuliano, and I am a beautiful train wreck. My goal is to build confidence in others, to live intentionally, and pursue your purpose. If you're new to HS Connect, hit that subscribe button and ring the bell so you'll be notified of the latest content as it's released. Be sure to visit our website, hsconnect.org, where you will find the latest information about hidradenitis suppurativa. Anything discussed in this video is intended for educational purposes only and does not replace any medical advice that you've received from your doctors. Today, I'm meeting with Dr. Stephen Davoli, a dermatologist in the Wayne State University Department of Dermatology in Detroit, Michigan, and is affiliated with multiple hospitals in the area, including DMC Harper University Hospital and Karmanos Cancer Center. Welcome, Dr. Davoli.
Thanks so much, Dominic. How you doing?
Great. It's awesome to have you, honestly. I've been speaking to some of the other members of HS Connect, and they have been expressing the excitement of the opportunity for us to be able to get to connect, for lack of better terms, but also to be able to discuss some really important topics.
Yes, and I totally feel the same way. I'm excited for the opportunity.
Excellent. I appreciate you meeting with me today. Can you tell me a little bit about yourself? But first, if a patient in Michigan were seeking your help, where could they schedule an appointment?
So my main clinic is in Dearborn, Michigan, which is a little bit outside of Detroit, just about 15 minutes outside of Detroit. I spend some time at the Veterans Hospital in Detroit too, but unless you're a veteran, you can't see me there. And then I spend a half a day at the Karmanos Cancer Institute, and hopefully you don't need to see me there, but if you do, I'm there for you. So my main clinic's in Dearborn, that it's through Wayne State University. So that's where you can find me.
Okay. And you are seeing patients for a variety of different conditions, not just hidradenitis suppurativa, but you, for lack of better terms, are considered an expert in HS. I've been reviewing your curriculum vitae, and it's very, very impressive. What's more impressive to me is the amount of commitment that you've been giving to this community. And on behalf of hsconnect.org, I cannot thank you enough. Thank you. Thank you for being here and sharing this information with us.
Oh, it is my pleasure. It's like you said, I kind of focus in medical dermatology. So not really the cosmetic side, some surgical things, but not as much as say someone trained in Mohs surgery would do. So I like the complicated and difficult derm diseases, and they don't get much more complicated and difficult than HS.
HS, hidradenitis, I kind of look at it as a cancer that cannot kill you. I think that was the best way that I've been able to visualize it and frame it in my life, that it's a very, very difficult and frustrating disease. Yes. However, we do need to put it in perspective that it cannot ultimately take our life like other diseases can. And I think that's one of the things that's been able to, despite the frustration that this disease presents, I've been able to cope, Not so much that I want to look at someone and say I'm worse off. It's kind of one of those things where, okay, this is this. We can put a name to it, We can have an idea of what we're dealing with.
Yes, and hopefully we can get an even better idea of what we're dealing with as we do more research, figure out more about how the disease behaves and how we can kind of counteract it and get it under control, which it's an exciting time for HS. I kind of got into it as a resident. We were seeing patients with HS and we would hit that roadblock of, all right, we've tried this or we've tried that. Nothing's really working. What do we do now? And people kind of threw their hands up like, well, there is nothing else. And I said, there's got to be more. We've got to figure out what we can do. And at the time, there wasn't a lot of research going on, but there were some really awesome, dedicated people helping HS patients. So I started reading up on the literature. And then, like you said, just with time, I sort of found myself being this HS expert. And the other dermatologists are sending patients to me saying like, all right, well, I tried the first couple things and they didn't work. Go see Dr. Daveluy. He'll figure out what's going on. And sometimes I do. Sometimes we just kind of are on a journey together, trying to wait for something better to come out. But I think it is kind of a hopeful time to have HS because it's having its moment finally. For so long, nobody was really giving it any attention and nobody was focusing enough attention on helping people with it. And finally that's coming around and happening. So hopefully soon it will be a different landscape when it comes to taking care of patients with HS and helping them through, like you said, such a terrible disease that doesn't kill you, but tries its best to ruin your life.
Yeah. Yeah. It pops up like uh like an ex-girlfriend, like out of nowhere. You're like, aren't you gone yet? I thought I
Yeah.
moved on with my life, you know. Probably a bad comparison, but that's what it feels like sometimes. It
Yeah.
feels like a really, really rotten ex that just won't
Yeah.
go away.
Never happy to see them. They
No.
definitely ruin your day and maybe your week, maybe your month. It's painful.
Gets your attention.
Yeah.
Yeah.
You wish you could just never see it again.
Yeah, yeah. I think that's one of the most frustrating things about having HS is not a lot of people understand what you're going through. And kind of like when you're describing an ex that you don't ever want to see again, you know, when you do start to describe these things to other people, they don't want to hear about it. So that kind of like exacerbates things. I get the feeling that, you know, it's a little bit harder, you know, to deal with the stress when you get kind of down in the dumps, you know. Has
Yeah,
that been any of your experiences with any of your patients?
absolutely. And it's funny, even on the bigger scale, we've been confronted with that when we're trying to work on HS awareness.
Mhm.
So there was a time when psoriasis had this really bad stigma, and people looked at psoriasis and nobody knew what it was, and everybody thought you were contagious and you had some infection. And now psoriasis has kind of come around where through awareness campaigns, people recognize it. They're like, oh, you have psoriasis. I get it. That's, you know, it's not contagious. That's just something you have. And then other skin diseases like vitiligo, people for vitiligo awareness, where you get the white spots on your skin. Now there's supermodels who have vitiligo and are kind of being
Mhm.
proud and showcases and embracing it and owning it, which is great. Well, with HS, we can't even have that kind of like own your disease awareness campaign, because if you
Yeah.
post things on social media, they might just get taken down for being vulgar pictures. So even that wraps into it, that it's like you said, it's this disease that you can't really talk about too much, and people don't like to hear about it because it's sort of unpleasant and they don't like the images they get from it. So it's hard for people when they come in. They're kind of like, yeah, a lot of times they haven't even talked to anybody about it. Like I always relate this story of a patient who came in, and she was an adult woman. And we were talking about HS, and I asked, does anybody else in the family have it? And she said, oh, no, no. And I know because my sisters and my mom were very close. We talk about all of our medical problems. So that way we know if anything is, you know, running in the family or we need to keep a lookout. She came back the next visit and she goes, you won't believe it. I talked to my mom and my sisters. My mom has it, and 2 of my 4 sisters have it too. We just never talked about it because it was in sort of our private areas and it was not the easiest. And she goes, we talk about all our medical stuff, but for some reason, this disease was one we chose not to talk about and to kind of keep it to ourselves and not share it. So she said, I talked to them, and it turns out they're getting medical care for it. 2 of them didn't even know what it was. So it is kind of one of those diseases that you sort of struggle by yourself, and there's that difficulty with even bringing it up to anyone, much less a doctor. And it unfortunately, it kind of makes people suffer on their own for a while.
Yeah, those were some of my experiences before I was able to find support groups and put a name to what it was. I was given a name, you know, by a doctor, but nobody really could give me a concrete idea of what it was that we were dealing with until I actually started reaching out to these groups and finding out, oh my gosh, I'm not the only one who has this disease that, you know, is just kind of like crawling its way across my body. And no one else that I've talked to seems to know what it even is. But people can put a name to, you know, cancer, diabetes, you know, a variety of other conditions because it's been more discussed.
Yeah.
Yeah, people know it.
Yeah, exactly. There's kind of this, we decided to talk about diseases and destigmatize them, but we haven't gotten there with HS yet. And we're still
Mhm.
trying to figure out how to get there and how to sort of increase awareness about it in a way that people will be accepting of, which is a challenge,
Mhm.
but we've got to do it because there's people out there who have it and they don't know they have it. Or like you said, they don't have a name for it. They know they've got something. They know something's going on, but there's no name for it.
Yeah, that leads into, you know, my next question. What is the ratio, do you feel, of patients, male to female, that you see? And what are some of your suspicions about that ratio?
So that is an excellent question.
Okay.
In the US and Europe and Canada, there seems to be about 3 female patients to every 1 male patient. So we think of it as sort of a female predominated disease,
Yeah.
but it's not true across the globe. When you look at other countries, some of them actually have more male patients. So Japan, South Korea, Thailand, they've reported more male patients. And even in the Middle East, more male patients have HS than female patients. And there was a nice group that did a meta-analysis where they kind of look at all the different papers and try to put it all together, kind of like take the data from everybody, put it all together and see what the difference is. And in their meta-analysis of all the papers from around the globe, they said it was about equal. So it doesn't seem to be female or male predominant. So then that kind of leaves us the question with, well, why do we see these variations? Why does it seem like in North America and Europe, it is a female predominant disease, and in Asia, it's a male dominated disease, but then when you average everybody out, it's about equal. And I think it's still a big unanswered question. And it's kind of the way the scientific method works, right? Is we notice a difference and then we say, okay, why is that difference there? Why is this happening? So we're trying to figure out, is there something genetic or with our ethnicity that is leading to these differences, something different in our genes? And in all honesty, we know that even across ethnicities, 99% of our DNA is the same. We notice the visual differences between different races and different people across the globe, but really that's a minority of our DNA. Most of our DNA is inside us doing all these kind of immune system and digestion and cell cycle things that are really important. And it's almost all the same across us. So a lot of times ethnic differences have more to do with other cultural things or other practices, something else more about our environment than about our genes, though our genes might play a role. And we're sort of still trying to figure that out when it comes to HS. And it's still kind of a new area of investigation, because each country kind of thought they knew their own ratio. And then they start seeing the global data and you go, well, why is it more common in males in Asia and more common in females in North America? And it's difficult because these population studies, it's easy to kind of say, all right, let's look at everybody who has HS, how many are males and how many are females. It's a little harder to say then, okay, well, why is that happening? Because then you've got to really dig deep and look at what are the differences in these different populations and what could be causing it. Is it a hormone effect? And I mean, there's so many things that vary when you look at people in North America and in Asia. So our diet is different. Our rates of obesity are different. Our smoking is different. So there was actually one study that they looked at the rates of HS in different countries, and then they looked at the ratio of smokers when it came to females and males in different countries. And they found that there was a trend, they kind of matched up, that in countries where there were more male smokers compared to females, they had more HS. So in the Asian countries, the smoking ratio is 4 to 5 males for every 1 female, versus in the US, it's about 1 to 1. They're pretty equal. And so it's a tricky thing, because then you go, oh, well, that's it. It's smoking. Mm-hmm. But that doesn't really tell the whole story, because now we just know that those two things both happen in those countries. But they also eat a lot more rice and a lot more bread in Asia than we do. So do we think rice is the cause of HS? Not necessarily. So we've got to do more research and figure out what are these factors that could be involved. And it's tough because maybe there are different causes of HS in different people. And maybe sometimes it's more genetic and sometimes it's more related to other factors. So I think we've got a lot of work to do, and it's almost more questions than answers when we kind of look at the gender ratios. And then sort of the even bigger question is, well, what about cultural practices when it even comes to seeing a doctor? How do those vary across countries? Because culturally, it can be very different. And I can only speak to my experiences practicing in the US, but guys are not the best about coming in to see the doctor.
No.
We tend to just power through and push through, and we put it off, like, all right, well, let me just handle what's going on at work and then I'll go see the doctor. Let me work at this job a while, let them know I'm a good worker before I take any time off. And we've got those sort of cultural practices too that might not even make the numbers accurate. Maybe there are more guys out there with HS than we even know about, and we're just not seeing them because they're just suffering at home and trying to muddle through it.
I can say from my perspective, being a white male, entering this, well, I'm 41. I was diagnosed with HS, and I had things going on. I was told that this disease is here to stay, but it just didn't click for me until it started like getting bad. And I think a lot of other males, you know, we get so ingrained into this, you know, perform, 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 in any weakness whatsoever that we show, we ourselves, you know, we have this fear, you know, if I show any weakness, then they'll pass me over for promotion, or, you know, maybe this girl that I'm, you know, looking at, you know, she won't like me if she finds out there's an issue. There's all these different issues. And this is my theory, based off of what my experiences were. There's all these issues that will affect males in North America going to see a doctor. It's the last thing you want to do. The last thing
Yeah.
you want to hear is to be told you have a problem, because you're not being told, then, well, the problem doesn't exist, right?
Right. Exactly. And like you said, there's a stigma, you know, like if you have to take a sick day and your coworkers have to make up for it, you go back to work feeling a little bit guilty.
Oh yeah.
Wondering if the reason that nobody's talking to you in the break room today is because you took a day off and made all their lives harder, and you look fine. What's wrong with you? Why did you take a day off? You know, you don't have a cast on your leg. You don't have a bandage on your head. And that's one of the challenges with HS. And sometimes we even have to write letters to HR departments saying, like, you can't tell when someone's flaring with HS. You
Yeah.
just are going to have to trust them that if they're flaring, they're flaring. And I apologize, but if you want to see it, they might be willing to show it to you, and you are not going to be comfortable with looking at the areas that are flaring up and what's going on. You
Yeah.
just need to trust that this person has a disease that can cause them to miss some days. But like you said, there's that stigma of sort of the, you know, tough it out, get through it, show up, you know. It's kind of funny. We laugh even at my work. There was one of the docs who was, I never took a sick day in 20 years. And then we had to kind of buffer that with, if you're sick, please do not come to work. It was flu season. And he was like, I've never taken a sick day in 20 years. You go, if you're sick, please do not come to work. It is not a downside for taking a day off when you are sick. Do not infect other people. You need to be at your best, but it's that mentality. You know, it's a weakness. It's seen as a sign of weakness to people. And it's a shame, because then it does kind of promote these issues of delaying your care and not taking care of things. And then, like you kind of started to mention, it's tough too, because when a guy goes and gets diagnosed with HS, a lot of times the doctor goes, huh, that's funny. This is more common in women. And this is more common in African Americans. And this is more common with smokers or with obesity and all these things that, yeah, when you look at the population, there are these things that are associated with HS. But it doesn't mean it applies to every single person who has it. And it's hard, because that's kind of the message people get when you see a doctor and they go, oh, you have this HS disease. That's kind of a woman's disease. And you feel like, oh, geez, now there's this extra stigma on me that I have a disease that's more common in women. Like, now what's wrong with me? You know, so I think that's another big thing, is we have to make sure that not like everybody, but even doctors understand that just because when you look at the population, it's more common in women, it's 3-to-1 male to female in the US. That still means for every 3 females, there's 1 male. That doesn't mean it doesn't happen in men. And that doesn't mean it says anything about a guy who has it, because please don't give us any more stigmas. We already question our manhood and our virility in everything we do.
Yeah, absolutely. Everything that you just said touched me on so many different levels, because those are some of the things that I experienced. You know, when I initially began to take this serious, I saw a variety of different doctors, and for my own benefit and for all of our all of everyone that's watching this, can you please confirm a few things for me that were said to me why I don't have HS? So you can confirm that HS is not an obesity disease. It's not. Now, don't get me wrong. additional skin will cause friction. I understand that's going to cause a lot more irritation. But I would like to confirm that HS is not an obesity disease.
Nope,
Um,
exactly. And it brings up a good thing. There's a correlation, not a causation. So
yeah.
just because that when we look at people with HS, there's a higher proportion of people with obesity. And like
Mhm.
you said, for some people, friction is a problem. For some people, weight loss helps. For other people, it doesn't. Even there was a study with gastric bypass surgery, and not everybody who got the surgery and had HS before got better. So it's not a cause of it, but for some people it's related. For other people, it has nothing to do with it. And that's true of all the risk factors or associated diseases we talk about with HS, is that when you look at the population, it's like, oh, these things are more common in people who have HS. But when you look at an individual, it doesn't mean a thing. You know, you're still talking to an individual person who has HS, and that those factors might not have anything to do with it.
Yeah. I was told I don't have HS because I'm not obese and I'm not lazy. And when I listened to that, I had to really, really understand what it was this doctor was telling me. She said, well, you don't sit on your butt all day. You don't sit around. And it took me a second. I'm like, okay, I know that HS is not connected to obesity as well.
Yeah.
However, I got to thinking, I'm like, but when I do have my flare ups, when I do have this, I'm like, I am dog tired. Like, if there, it just, man, anyone who suffers from HS, I don't care if it's stage 1 or stage 3, knows that 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 fatigue, that feeling, you're like, man, did I just run a marathon? I know that that is a very, very significant factor. That's one thing that pops up. And I don't think, it's not a causation, but that's one thing that comes along with it, I've noticed.
Yes, yes.
Um,
And it's funny, there's a group of us who we're working on tools. So when we do these clinical trials to test HS medications, we can sort of have these tools to help us measure, is the medication working? Is it helping? We're developing one for the fatigue
yeah,
because it is real. And it makes sense. Your
yeah,
body is working overtime, like inflammation requires a lot of work from your body, and it
mhm,
burns up a lot of energy, and it releases all of these internal chemicals that just tell your body, like, take a break, hibernate a little while I heal. You know, it's like we always tell people, oh, you need to rest and heal. Well, your body sends signals for that. And unfortunately, in HS, it flares up. You get all this inflammation, and your body goes, take a rest, let's heal up. Only it doesn't stop the way it's supposed to. It just keeps doing that again and
yeah,
again. And then it's funny because, like you mentioned too, they say like, oh, you don't have HS because you're not lazy. Well, for a lot of people, exercise is a trigger for flares because there's friction involved and the
mhm,
movement. And so it's hard for HS patients to find ways to be active and exercise that aren't going to flare things up, because what do you know? It shows up in all the places that move. For just about every exercise you try to do, it's where skin rubs on skin. It's the places that if you don't have HS, you might get some chafing when you go running or when you go working out. So imagine then you have HS in those areas and the chafing happens and flares it
yeah.
up.
As someone who had HS underneath my armpits and who works out every single day, I can tell you it just about drove me crazy. I am one of those people that if I stop working out, though, I'm probably just going to go kaput. So I'm not encouraging anyone out there to put them through the stress that I put myself through. All I am saying is that friction when you're working out, I understand why a lot of people are incapable, of working out, of,
Yeah.
of participating in sports, because it is extraordinarily painful.
Yeah. But you make a really good point and find out what works for you, right?
Yeah.
So you said like, all right, I know working out is going to flare my HS at times, but I need to work out. For
Yeah.
other people, it might be slightly different. You got to listen to your body, do what's right for you, do what brings you joy in your life, and try not to let the HS take that away.
Yeah. I think that runs along the lines with what I'm trying to do in life. My goal is to build confidence in others, to live intentionally, and to pursue your purpose. that's something I try to instill in people, whether you have HS or not. I think that's something that everybody needs to be focusing more on in their life, because that's truly what's going to bring us happiness. I think one of the things that I've noticed with other men that I've spoken to with HS is we get so like down in the dumps about this one thing, the HS diagnosis, that we make that our whole life. We create this story that, that it's the only thing that exists. Has this been some of, what have been some of your experiences listening to your patients describe the conditions of the life that they're living? What have been some of those experiences?
Right. Yeah. It's such a good point where it can just dominate your life. And I always remember there was a patient, and he was a man in his 20s, and he had pretty severe HS and pretty widespread involvement. And so we had him on some medications for it, and we were doing some of our minor surgical procedures for some of the spots that weren't responding. And so in dermatology, we're doing procedures in the office, you're awake. So we make chit chat. So it just kind of came up, oh, what are you doing this weekend? And he's like, oh, nothing, this or that. And we said, oh, well, it came up. Are you dating? Are you seeing anyone? And I was just crushed when he said, no. How could I ever date? Who would ever want to date me? How would I even approach someone?
Mhm.
And it's like you said, he had sort of, the HS had taken that away from him and just made him so that dating was not an option and talking to people was not an option. And that's a real challenge with HS. It's hard enough to go talk to someone who you're interested in, and at some point they're going to see you naked, and that's a challenge. It's even worse when they're going to see you naked, and before that happens, you need to disclose that you have this disease that's not an infection but might be flared up, and it's going to flare up before you go on a date because you're going to be nervous about it, and it's just the way it's going to work. It's like Occam's razor. If it can go wrong, it will. So of course it's going to flare up right when it's like the date where you're going to get intimate. So it was just devastating to hear him. And we talked about that. I said, you know what? Don't give up on it. At least try. And if things don't work out, you didn't lose anything for trying, but don't let it take that away from you. Don't let the HS tell you that you're not going to talk to people that you're attracted to and that you might want to date. Go out there and do what you want to do. Now, if you don't want to talk to people, that's fine too, but don't make that your decision, and don't let the disease run that part of your life or take that away from you. And I know it's not easy. It's hard because when you go to talk to somebody, it's going to jump in your head, but with time, you can get better with it and you can come to grips with it. And like you said, support groups, talk to other people who have HS and who have walked this path before and have overcome some of the obstacles, and maybe what they do won't work for you, but maybe it will. If nothing else, it'll let you know you're not alone and there are other people who are on this path.
Yeah. I've noticed that my fellow men, not to throw us under the bus, but these days, like, dating doesn't seem to be as much of a thing as it was, in the past. I know historically it wasn't what we consider to be dating today. It used to be more like, okay, this family knows this family, and well, hopefully the two get together.
Yeah.
One thing I've noticed about the dynamics of dating over even the past 20 years is that men and women don't talk the way that they don't communicate the way that they used to be able to, without these stories that we already put into our heads. And one of the things that I have been noticing as I read some of these studies is that it's the anxiety, it's that story in people's heads that's affecting them more than anything else, more than the disease. It seems to be that the mental impact is keeping people, even when they're not flaring, they're not going out and meeting people, which in turn has a long-term impact because, well, everybody wants to feel like they deserve to be with somebody.
Yeah. Yeah. And that's one of the toughest things with HS is the mental impact.
Yeah.
And I think, not to call out my profession, but I think we need to get better as physicians at taking care of people with HS, because I think we sort of contribute to it in a way, and hopefully not me personally, but the delay in diagnosis, the seeing all these doctors who don't know what you have, don't know how to help you. It's discouraging. it's already this disease where it's pretty relentless. It just keeps flaring up and keeps showing up. And sometimes it even progresses and just gets worse and worse. And then you see a physician who doesn't know what's going on and doesn't really help you. You sort of get jaded and you think like, all right, no one can help me with this. There's no hope. Yeah. And I think hope is a big issue with HS where until people have that hope. And it's funny because when people come and see me, whenever I'm talking to doctors, I always tell them, number one, when you see a new HS patient is you have to give them hope. You have to let them know, I'm here for you. I know not everything we try is going to work and is going to help, but I'm not going to give up. We're going to keep doing this together. We're on the same team now, and we're going to figure out something that will help you. And that hope is amazing. And it's funny because we even talk about in the HS clinical trials, the placebo rate for the people who aren't getting the medication, but are getting sort of the dummy medication, just because they have to do that in trials so no one knows who's getting the medicine and no one knows who should be getting better and who shouldn't. The placebo response rate is actually pretty high in HS. And they think part of it might be that when the patients enter the trial, they have hope. I might be getting a new medication that might really help me. And that influence of hope on the body can be amazing. When you actually sort of think this might work, it might work. And then, like you said, the contrary is true too. When you lose that hope, it permeates into everything you do. It just is that nagging voice that is telling you no for everything. And you can't do this and you can't do that. And you'll never be successful. And it's really horrible because when that voice is coming from your HS, you can battle your best to ignore it, but there's constant reminders. And so I think it's a good topic too. And we're kind of talking about men with HS today. Men are not the best about talking about our feelings.
No.
We're kind of from the same generation where like my dad doesn't say I love you, but I know he loves me. That's just how we are. We don't say it. I remember when my sister got into junior high, she started saying, goodbye, Dad, I love you. And he would go, okay. And she said, no, you have to say it back. You have to say that back to me. And he's like, well, you know I love you. And she's like, Dad, you have to say it. So then, and sorry, Dad, if you end up seeing this, he's going to be like, oh, I'm getting called out. But it was that generation, right? Men don't say I love you. You just know your dad loves you because he works hard and he provides for the family. And so I think men kind of have that stigma of we don't talk about our feelings, but when you're struggling with these things, there are people who can help. There are professionals who can help you to kind of reframe your thinking. And it's an important thing for people with HS to know that there's help out there and that, bring it up if you're feeling hopeless, if you're feeling stressed or anxious, because you don't want to enter that vicious cycle of my HS causes me anxiety. My anxiety flares my HS. I'm, depression, anxiety, all these issues where it's hard. And we guys aren't traditionally very good at saying, hey, I'm struggling with mental health issues. This is stressing me out. Like we kind of talked about earlier, it's kind of a just power through, be tough, walk it off.
I personally think that the only way that we are going to address this is by changing our perception of HS. Have you ever heard HS is being referred to as a non-glamorous disease? It's not, poetic. It's not as glamorous as the other diseases.
Right. Yeah.
I think, and I'm not saying glamorizing it, I think putting a spotlight on it is the more appropriate way to look at it. If we as men, and I know, you haven't been diagnosed with HS, but if we as men make it our priority to take care of our health, first, I think that we stand a greater chance of dealing with these other mental considerations that come along with it. Because we discussed, before we started recording, comorbidities of suicide, anxiety, depression, all these things are existing. But I have to ask, okay, are these, what is the impact? We're stating that these are appearing, but what is the long-term impact, and how can we address it? I think when I look at the lack of research in men in HS, I think especially based off of our conversation, a lot of it has to do with the fact that men don't take it serious, even though it's a very serious disease. And I really appreciate the opportunity of being able to discuss these issues with dermatologists such as yourself, because then we can go back and say, okay, this is what we learned from this doctor. This is what we learned from this doctor. And this is what we can give to this support group and say, okay, these are the things that we need to make our priority.
Yeah. And I think another step to that is we need the men with HS to really be involved with the things we're doing when it comes to advocacy and research and patient awareness and disease awareness, because they are sort of, at least in the US, outnumbered by the women who have HS. And I applaud everybody with HS who is raising awareness and raising money for research and participating in research. But we need to make sure that the men are included in that and the men's voice is heard. And you know, like, great for you, because it's good to be a man who's outspoken with HS and sort of setting the example of, you know, we men with HS need to speak up, we need to be heard, and we need to be driving some of these decisions that are happening and these things we're doing. And I think you're totally right. We need to find a way to get the message to men. I always remember, and I can't remember what brand it was, but way back, I don't know, in the 90s, probably, there was the commercial and they were trying to advertise soap and body wash. And I forget which football player was even in the commercials. And he goes, "What's this thingy?" And it was like a little scrubby brush, you know, and it sort of was destigmatizing using a scrubby and a body wash to men.
Are you talking about the loofah?
Yes.
I can't imagine taking a shower without my loofah. All right, I'll have you know.
Right.
Using the loofah is a very manly thing, you know?
Yes. And so that's, I think you're right. We've got to find a way with HS to talk to men in their language, you know, find a way to say, like, hey, there's this disease. And yeah, your doctor might say it's more common in women, but that doesn't mean anything on you for having it. In fact, it might even be more severe. There's evidence that shows men get more severe disease on average. So, you know, it's even more important that we reach out to the men and kind of make sure that they know that this thing exists. And I think another challenge of it is that we men, this is kind of a non-glamorous issue too, but we tend to have more body hair. We tend to kind of be used to pimples popping up here and there. Oh, I sweated and I got some pimples on my thighs. I got pimples on my butt. And so it's important to send the message that, hey, you might have something a little more serious. You might actually have HS. Don't brush these things off as like, oh, guys are just hairy and sweaty and they break out in pimples in places. Like, it's important we get the message out to know when could it be something more and when should you go in to see your doctor and bring it up.
You know, it's funny you should mention that. I have a buddy of mine who never really took any interest in, you know, any of the weird crap that I put on YouTube, but he heard about, you know, a video that I put on YouTube about HS, and he actually sat down and watched it. And he was like, you know, I thought I had body acne, and I went in and I actually went and saw a dermatologist, and she told me that you have stage 1 HS. And she was like, or he was like, I couldn't believe it, you know, but she told him, thank goodness you came to me now before it gets worse. And I haven't spoken to this guy in you know, months, and just out of nowhere, he sent me a message on Facebook saying, hey, thanks for being willing to speak up about this, because I don't know anybody who even has this, you know, let alone, you know, that like speaks about it, you know.
Right. Yeah. And that's it, is we've got to get the awareness out, because I think part of it is the doctor piece, right? Like, we've got to make sure all doctors are better at recognizing HS and knowing that it's nothing to brush off and it needs treatment. And then there's kind of the public awareness piece, so people know to go see the doctor, because yeah, we want to catch it when in the early stages, when it's milder and not advanced, and we can start treatment earlier. But we can't do that until people come in at that stage and kind of stop. And it's hard, because the other thing that's always tricky with HS is it comes on around or shortly after puberty in a lot of people. So that's kind of a time of a lot of changes. Your body's doing all kinds of weird things, and you just kind of chalk it up to, all right, I guess this is like another puberty thing. I grew hair in my armpit, and now I'm getting these like oils in there for some reason. So it just speaks to that. Like, we kind of need to make people aware of it so they can bring it up, and then make doctors aware to make sure they recognize it and go, hey, you do have HS. Let me send you to a dermatologist who can help you out.
Yeah. I really, really appreciate all of the information we've been able to share here. I feel that we are moving in a very, very positive direction with with the research that we're able to conduct right now. Off camera, we did discuss, the lack of research on men seeking help for HS, and that's, as a researcher myself, that is something that I am very interested in. And we spoke about, what it would take to facilitate a study. And right now, I am trying to work on a survey to get ideas of the things that are affecting people. I think my next step is to conduct some qualitative interviews and bounce some information off of you. What are some of the things that are keeping from people from seeing you as a dermatologist? And I think that's one of the directions that I want to go in next.
Yeah.
I really, really appreciate your time today. Um, is there any other organizations that you would like to discuss? Is there any other organizations that you work with that you would like to promote?
Yeah, HS Connect is of course wonderful. And then the HS Foundation is another great resource that kind of brings people together. And the HS Foundation has grants. So they have research grants if you do research for HS to help support that. And they have some patient awareness grants too. So if you're in the business of spreading awareness and having events to kind of raise awareness, they can help support that. So those are both great opportunities to help kind of get the message out there and get the research going to figure out what we do next. So those are both great. The American Academy of Dermatology is a really great resource for skin health in general, and they're getting more information on HS on their website too, and they can help connect you with dermatologists. So those would be the places that I would go for sure if you're looking for sort of the next click.
Excellent. Thank you, Dr. Daveluy. I really appreciate your time today. I cannot tell you enough how excited I am to have this opportunity to share the information. You are a wealth, like a walking compendium of HS, and it's great to have resources like yourself available in the community.
Yeah, thank you so much. This has been awesome, and thank you for the opportunity. Always great to do anything we can to make life better for people affected by HS.
Excellent. So okay, I looked at that article you sent me about smoking. Where'd it go? I have like 5 things in front of me.
Yeah, it was kind of an interesting one. And it brings up a topic that I think is really confusing for the public and for patients, but even for doctors sometimes, is like correlation versus causation.
Okay.
Like these two things both are happening in these populations.
Yeah.
Are they related? Is there some sort of cause and effect? Or is it something entirely different? Because I mean, like we were talking about the cultural issues with guys not going to the doctor. Well, maybe those are some of the same issues that influence the number of guys who are smoking in those countries. So I know smoking is a tricky issue because there's the association with HS, but then so many patients are confronted with that misinformation when they go to the ER that you have this because you smoke. So I'm always really careful when I talk about smoking in HS because there's sort of that stigma that shouldn't come with smoking. And for a lot of people, if they can quit, it helps. But we don't even know in the studies what came first. Did you start smoking before you got HS, or did you get HS and because of the stress you turned to smoking as some sort of an escape or a release?
Yeah, I know exactly what you're talking about. I can say this: I smoked for a very long time back when it was cool to smoke. I don't know how cool it is to smoke anymore. I don't do very many cool things these days. But I didn't have HS when I smoked. I didn't have HS. I blew up to like 300 pounds after I got hurt and retired. I didn't have HS when I blew up. I didn't get HS until I got back in shape. Like I would say that was probably the least stressful time of my entire life. Like, so I'm reading all these different studies. Patel 2018 was talking about the association between HS, depression, anxiety, and suicidality. I didn't even know that word existed. Maybe I wrote that down wrong. But it talks about these high stress levels. And the same with Montero Vilches 2021. She was talking about the reproductive potential and outcomes. Interesting way to put that, but reproductive potential and outcomes in patients with HS. And they were basically saying that the females, but there was the higher levels of stress was what was driving that. And I don't know.
Yeah. And I think it's one of those areas where I think there are different subtypes of HS, and we're starting to kind of figure some out. And I think for some, maybe diet's an issue. For some, maybe smoking is an issue. For some people, maybe the weight is an issue, but for others, it's totally independent. I think it's maybe just the immune system. And then it's kind of interesting too, like we're paying so much attention now to the microbiome, sort of what bacteria lives on our skin, what lives in our gut. And how could that possibly be related to disease, and specifically HS? Because we know there's a microbiome in the gut that might influence it. And then there's also the bacteria that are in the lesions. And even though it's not an infection, there's still bacteria living in our hair follicles all the time. So I think in the future, we're going to start to learn more about these subtypes of HS and why certain people, what are your risk factors, or do you just not have any risk factors at all? Are you just one of those unlucky people where it was in your genes and it was just waiting to flip a switch and turn on?
I run along the same lines that you're thinking, that there are different types. I kind of looked at it as cancer that can't kill me. That's how I've tried to explain it to other people, because people get it in different places and all